tonight we all gather together to explore the exciting topic about breast implants innovation, about the about the history of it, about the future, and about, of course, the women's choices. So tonight we are having a great panel of distinguished guests, and we will deep dive into this topic from so many different angles. We will have 3 presentations at the beginning of our speakers, and then we will all gather together in the panel discussion. So I really want to encourage you to ask questions proactively, and if you have any concerns, thoughts, just raise your hand and ask, and stop us in the middle of our presentations at any time. And tonight our first speaker is our amazing, bright and shining star, Agnieszka Studente. She is the Regional Sales Manager for Eastern Europe and CE Sales Director for Polytech. And she will guide us through how the breast implants technologies have evolved and what truly makes an implant innovative. So
yes,
the floor is yours.
And thank you very much for invitation. And why I'm here with you today, because first of all, I'm woman. I'm not hiding that. And I'm also near 50 years old. I have 2 daughters, and I have also undergone 2 breast surgeries myself. So I'm a little bit know also what I'm speaking about. And I'm asked to present a little bit history of the breast and how not breast, but breast implants, and it is really very exciting and long. So I will try to cut it short, but before we reach these new designs of the implants, these innovative products, you know, there was a lot of steps before. And we all must have some preference in cars, and sometimes the middle car is from 1962. We would enjoy a nice ride. However, I think for daily life we would prefer to have the new modern one, and definitely we would not want to return back to this older model. The same is with baby strollers. Ladies, if you have children or you have help, sometimes, you know, the modern stroller, lightweight, transformable, is much more comfortable. And the iPhones and like that. So history of breast implants actually starts not when first silicone breast implant was implanted, but long before. So it's almost 75 years old history we speak about. This is first material, implant-like material, from 1951. And as you can see here, we see a real implant now in the box. It was presented in a jar. So you open the lid, you remove it, and then you implant into the patient. This is completely spongeous material, no silicone gel, no saline water fill. After that, John Pangman, who was inventor, he did several more patents of that. One of them, again, very interesting to look, we have it also in Dieburg, Germany. Implants were delivered as a pair. So actually, if you had a breast asymmetry, anyway, you needed to have the similar sizes, yes, because it was 2 similar sizes in the box. Also very interesting. Also covered with polyurethane foam, by the way, yes, not smooth. At the same time, around 1960, I brought here, this is not so old implant, but we can give it around if possible, yes. This is a look-alike, a little bit of the first implants, how they were. They were very soft, smooth, and like that. I will jump over this history, which is long, long, long. Implant box, like here, we see almost on the table. So we have the sterile packaging, and everything is different, like from 1950s. And the interesting fact, which not many people know, that in the late 80s, it was in USA, polyurethane coated breast implant market share was approximately 40%. So it was quite a lot. So if sometimes I'm asked how old is polyurethane implant, so this is very old. Yes, this is grandfather of the implants because it's almost 70 years old. And when, unfortunately, due to different reasons, silicone implants were banned and no longer existed in USA, Polytech was left without any products. So we needed to think what we do next. Yes, because we were presented into this history a lot. So we started to develop a new generation of breast implants in Germany. We made some part of production in Brazil, and then we did sterilization in Germany. A lot of processes. What I want to highlight that since 1994, I think that maybe some ladies are born in that year or even later, we already switched sterilization of breast implants from ethylene oxide to dry heat. Why it's important? Because ethylene oxide is still used in some breast implant manufacturers as a sterilization, and it can lead to lymphoma. Yes, there are a lot of clinical papers about this, so this is not very unharmful substance to use. So since 1994 we use it. In 2008 it was a major year for us because we moved all the production in Germany. Yes, so all the processes are now controlled. In 2016 we were acquisited by biggest German investor fund, yes, DBAG, and so on and so on. 2024, this is a year of success in Polytech because we have a new CEO. He is professor, he is also plastic surgeon, so he is bringing a lot of new innovations into Polytech. Yes, so this is very, very interesting for us. It's very exciting, and I think that more new products will be released also upcoming years. Breast surgery is a very intimate process, yes, so women like usually to touch implants, and I think we will have also opportunity to go later to the exhibition and also explore those. And in terms of surfaces, we have really everything presented, yes, we have smooth implant, we have two types of micro-textured implants, and we have also microtane or polyurethane covered implant. So this is all for the choice. In 2013, B-Light was born. It is the first and only lightweight implant. I think that this can be really called the innovation, yes, because it was created because one brother, Jackie Gavri, was plastic surgeon in Israel, and his other brother was bioengineer. And Jackie approached Dale and said, I have an issue because I'm so successful plastic surgeon, but I have some complications after breast surgery related to the implant weight. Can you help me? And he said, oh, easy, I will help you. But unfortunately, it was not so easy. It took 10 years before 2013 before these implants were created, because it was a lot of work. Hooke's law about stretch, I know that I remember my childhood. I didn't have a lot of toys to play with, and I loved my grandfather and garage, yes, so I played with the springs. And you know that if you overstretch the spring, it doesn't come back. And it is same with the woman's tissue. We have some capacity to stretch, but then over it we can no longer do. And this is the same with the implant. And if we look at this glass of water, how heavy it is? Who can tell? Approximately, what do you think?
How long are you gonna hold 200 grams?
Sure, yes, so it's 200 grams. If I'm now speaking, I can finalize my presentation, I will be fine. But if you will ask me to sit while you all will be enjoying the evening, the rest of the evening, I will start to feel heaviness, yes? So women are carrying the breast all life. So each gram added, I think it makes some difference. So that's why it's visible. Also, this is a running woman without, of course, sports bra. We see the amplitude of the movement of the breast. And sometimes we women love to go without the bra. Yes, so this is our little sin, and I think this is a little bit nightmare for the plastic surgeons, because after my breast augmentation, he said, you never imagine to go without your bra again. What I wanted actually to do was going without a bra, yes, because I wanted to show off this, yes, the new breast. So B-Light, what is inside the B-Light? It is little tiny white microspheres. They are very safe, very strong, biocompatible, so they cannot, create any body reaction, like we are afraid that something bad can happen because we are having some foreign body inside our breast, and we all know that some risks with silicone are highlighted things. So what we wanted to know, find in the B-Light, that we are adding nothing harmful, yes? So material which is very thoroughly inspected. And it can survive very extreme environment. It is used also in the spaceships and in submarines, yes, where is high pressure or very high temperatures. So you can base and do. What is one of the benefits? Really fast recovery after the surgery. And what you see here, it's a funny video where you can see that silicone implant, where when you drop something, it is like doing the waves, yes, it's moving. The B-Light is linked to block the movement. So this is a secret between. We all unfortunately know that risk to have a breast cancer is 1 in 8 women, or even now more, because the technologies are improving. So there is very good positive advantage of B-Light, yes, that they are more transparent under mammography, yes, so you can inspect your breast and you can evaluate breast tissues very well. Safety in case the implant is ruptured. One of the questions frequently asked, what is happening? So the gel outside the B-Light implant, it will go much slower because of the microspheres which are keeping the silicone gel close, yes, like holding hands very tightly. And I brought one B-Light implant here. It is completely fresh, just to show you what we put inside. It's the instruction of use. It is also a small implant card. And then we have 2 sterile packages, yes, of the implant. And I will just open it and I will give you also the B-Light implant and standard implant to check the difference. So goodbye implant. Yes. So I will pass you, starting from gentleman. Maybe he will not be inside the phone.
I have a question for you.
Yes, please.
From the beginning of introduction of B-Light technology, you changed the gel, or it's still the same throughout the years?
What we changed a little bit was the edge of the implant. Yes.
So the shell was changed.
No, shell is the same. We just,
Design of this shell.
a little bit design of this implant was changed, and the next year we plan to release the edition 2.0, of which will be completely different. Yes, so it has changed. Plus we added, of course, microtane surface, polyurethane foam.
But it's only about surfaces and shape.
Yeah,
It's not that
yeah.
the gel
The gel
inside.
itself,
No,
it's still the same technology as
of
from
course.
the beginning.
Yes. Because in fact, if you want to achieve more lighter implant than 30% lighter, it becomes more stiff. So you are
Yeah, the question probably
losing-
comes
yeah.
from our discussion with
Mhm.
Andrew that what was maybe a possible disadvantage of B-Light implant, that you try to place it inside the breast, it can kind of change its shape due to rigidity. It's like not very elastic.
now it's here in, at least I feel that here is a higher temperature, that here is not a very cold room at this moment. So if we would go outside in a very cold weather, we would feel that it also becomes a little bit harder. If we sink inside the body where it's 38 degrees, it becomes
softer.
more softer and warm. So this is just for women. And in the choice when patients are coming, yes, it's very important to explain this all, and of course to speak about this, yes, that in the body it will be different. And that's why we also offer warranty program with very good coverage depending on the implant type, and everything is, all you need to do is register. And then everybody, all the patients can be very happy and satisfied with this result. But that's definitely, I could prepare more and more about history. I just don't want to cut the story short.
Thank you so much. I mean, it's been really interesting, and you covered already all my questions I had, and you touched upon all these topics which are current in our news, in our media, that celebrities are going into the space, Katy Perry and Jeff Bezos, fiancé, with the breast implants, and it's already the new technologies are following the steps of the women in space and adjusting to the very hard environments and very different environments. It's not only about the jogging, it's already about going up into the space.
So Polytech is not only in this planet, it's
Yeah,
expanding.
We plan to
Expanding.
compare Venice and Mars, Venice, yes. But definitely you really can dive, you really can swim, you really can fly, and you can go to sauna if you want. It's not of course not first months you cannot do extreme sports. Yes, so just I think you will speak more about things.
So women became limitless, and there's just nothing to stop us from
conquering the world.
Yes.
With or without breast implants,
Yes.
because this is a choice.
Yes.
And today I want to talk about breast implants, and of course, as every surgeon here in the Nordclinic, during the week, I would say that, or even once a day, you have to, deal with the breast. So it's a topic that is very, very important to us every day, and I don't want to say that we struggle, but we have all the challenges, and of course, as a team, it's easier to overcome them. Okay, let's talk how I see them, but just before, let me just give you a few numbers with statistics. 2 million people during the year will get breast augmentation, so that's a big number. And if we talk about complications, it's from 2 to 16%. So that means that there is one very lucky surgeon who has only 2% of the complications. Overall, people are very happy with the results regarding breast augmentation, and they would say that about 80 to 90% are satisfied with the decision that they decided to go and make the surgery happen. But myself, I don't consider myself being that lucky, or maybe I'm not that good surgeon, and I would say that all my patients that come to have breast augmentation one day have to find a surgeon and do something about the breast, because they're gonna live long time, right? Usually all the patients are in their 20s or 30s, so that means in 10 or 20 years time, something will happen with the breast. Either the implant will go ruptured, they go capsulated, who knows, or maybe the body will change, so that means that the implant will stay the same, but we will need a lift procedure. Maybe the baby's gonna change how the breast look and so on. But once you get the surgery, there's a big chance you will need another one. So maybe it's not the same as complications, but the rate of reoperation for my patients, I would say that it will be almost 100%. Okay, so let's come back here. How I see it. So you can see that as an implant, I want to compare it with a plane. The outset of the plane is pretty similar. Again, few wings, few engines, wheels, and it flies. And you can give to a 5-year-old a paper, and he will or she will make an airplane, and it will fly. You can see that inside of the plane is much more complicated. There's many little buttons and screens, and I don't know what they mean. And if you compare it with implants, it's completely opposite. I see it completely opposite. I think that the inside of the implant is relatively simple, and the outside is more challenging. The outside looks more like this. And let's start with the inside. Most of the implants that we deal with today, they are silicone-based inside. Okay, we play with a different cohesivity, so that means that ones are a little softer, the other are harder, and of course, for anatomically shaped implants, we need the harder materials to keep the shape and so on. And of course, we have saline implants. They are not that popular nowadays, but still I have a perfect situation where I would put them, and it's bodybuilders. Do you know that they during the competitions, ladies, they go basically with 0 fat in their body. So they have muscle and skin and nothing more. So if you put an implant, something like that, with all the wrinkles, that will be very visible because it's not covered with the adipose layer, since the girls have none of it. In that case, the saline implant is the perfect solution. You put the implant and you overfill it. It becomes like a balloon. It has no wrinkles, no visible wrinkles. Of course, it's pretty solid, but it works well. So that's the good example for this. And I still, if we're talking about the inside of the implant, I have to, talk about the innovation here, and that's the Polytech stands out here with the B-light implants and the little silicone and the little sacs of air that is stuck in that silicone, and that makes the implant lighter. And I think that's well done for the Polytechs because of this innovation. Okay, now let's talk about the outside of the shell, and probably you see that there's two guys operating the plane. Probably the implants are not that difficult to operate, so you need only one surgeon for that, not two. But here you have different surfaces of implants that we have, and we have starting with the smooth. Then we have motiva, that is not completely smooth. Then mesmo implant, mentor siltex, and all the surfaces are very different. Okay, and then the last one is microthane. That's the polyurethane that Agnes already mentioned. So you can easily get lost in those textures, and if you are a user, not a surgeon, it's your one time in the life experience, it can be complicated to choose what to go for. And we have the classification for that. And in 2024, a new classification came for the implants, trying to put them in the different positions. And we start with the smooth implants. Basically, they have no intentional texturization of the implant. Then the next one is additional coating layer, so that the polyurethane would be additional. So that means that the silicone is surrounded with the shell, and that shell is again surrounded with the polyurethane that will be in the contact with the surrounding tissue, not the silicone itself. And then the last group would be all the implants that has intentionally textured surfaces. So I'll show you the next slide, and you can see that that's the first group of smooth implant. They have no intentionally no intentionally textured the implant, so basically they are smooth completely. Then the next group, as I explained, was covered with a different material, and that's microthane implant covered with polyurethane. And then the last group of the implants that I mentioned were intentionally texturized. So all the Motiva, Polytech Mesmo, Siltex, Motiva Silk, and polytextured implant that we have here, they all fall into the textured implant group. And because of the new classification, they are all now called microtextured, because they have the texture is less than 50 micrometers. So that's the new classification of the implant. And again, we have to understand that different surfaces will create different capsule. And probably everybody knows that if we have implant, we put it in the body, and it's with any implant, whether it's a joint or you put in the older days they used to have those pregnancy implants. The same capsule will be formed because it's just how our body reacts to the foreign object. All those different textures will create a different capsule. So we have to understand that capsule is the thing that holds the implant in place. And in most of the cases it will be formed, it will be solid thing that will fixate where it should be, prevent it from moving when you are running, and so on. So that is a very good thing and helps us as a surgeons a lot. However, two extremities. In one, the capsule is too thin, and we can have the bottoming out where the implant slips down, or the implant capsule can become too hard, and we have a capsule contraction. That's another complication that you can face. So knowing all those things, I think the surgeon is the one that can choose what is the best for every situation. And nowadays, when the patient are coming and saying that I want the breast augmentation, usually it's me as a surgeon who chooses the implant, saying that you probably need this or that to make sure that your lifetime of the implant is as long as possible. Okay, so foreign body reaction and bacterial contamination. These two things that we need to address when we are dealing with implants. So let's start with bacterial contamination. Was one of the hypotheses why capsule contraction can happen is a subclinical infection. Little bacteria stuck to the implant and irritates the capsule. The capsule are growing, becoming hard, start squeezing the implant. So basically what we do, we use all the antibiotic solutions, we use iodine or other antibacterial solutions to make sure that there's no bacteria present. The funnels, where you try to use no-touch technique, and every time you take an implant, you use a new pair of gloves, and so on. The other thing that we are fighting is, of course, the foreign body reaction. And all those three words are pretty hard to pronounce, but triamcinolone is a very common medication that can be used in our practice to fight all the scars, not only on the skin, but probably for the capsule as well. Biggest problem is that only few patients will need it, so you cannot really incorporate it in the shell, because again, who knows whether you're gonna get a capsule contraction or the capsule will be too thin. So it's a problem. And another thing is, once we diagnose that somebody has a capsule contraction, the process already started. So it's very hard to apply those medications on the process that already started. So that's probably the biggest challenges that we fight today, or the biggest challenges that I see today as a surgeon in this breast surgery industry.
Are there any particular lifestyle habits, smoking, no smoking, drinking, non-drinking, I mean health issues that women may have causes these side effects?
Yeah, so I don't think that it's scientifically proven, but sometimes I see that for the smokers there are more chances of capsular contraction. Again, today I have to do my reading. Maybe it's something has changed, but I haven't seen scientifically proven data that smoking increases the chances of capsular contraction. And another thing is infection. If we have infection in our bodies, let's say in the teeth, common bladder infections, so that means that small amount of bacteria probably will be circulating in your bloodstream. And bacteria really like to settle where there's poor blood circulation. And the implant is the perfect place for that. So again, I had few cases where we were constantly fighting with capsular contraction and changing the implants, and the lady were coming back, and eventually we decided to remove the implants completely and not to have this series of unfortunate events. So that's my experience.
And when you showed so many different surfaces, and you said already that you are choosing for the particular case what works the best. So basically, we as the potential client of yours, we do not have to read about different surfaces, nothing. We just have to trust the
Or you
surgeon.
can read if you want, but
and-
it's the same that with that little beautiful photo with the airplane cabin and the pilots. So if you have a driving license for a car, it doesn't mean that it's going to be easy to become a pilot and drive a plane. It's not the same that you do a little bit of reading and then try to understand what's the best. That's why we spend 10 years in practice, understanding, learning, and so on. So I think that's how you get your pilot license for this.
True, absolutely true. Do you have questions to Andres? No? Nothing? No. Professionals in the back? No?
It's a common, like most common choose for the implant on a daily basis.
That's a very good question. I have at the moment, I have in my pocket, I need Motiva, I need Mentor, and I need Polytech. Then the lady comes, I see what she has, what anatomy she brings, and then decide from those. And I think if I have those three in my pocket, I can cover probably 99% of the cases, and even revision cases where something is going wrong. So with the polyurethane, Motiva, almost smooth implants, you can do quite a lot. You can really help.
And in terms of the sizes and of the trends, are there any particular changes in terms of?
Yeah, so back in the maybe 30, 40 years, big breast was something to have. Everybody wants to show that they can afford plastic surgery. And probably nowadays, everything is, they want as natural as possible, and they just want to be comfortable. And just imagine going for a run with that implant that was sent here. So that would be, pretty big challenge. You cannot do marathon under 3 hours with those.
True.
Yes, the gentleman in the back.
Yeah. Hello everyone. I would like to ask the doctor, how important for you when choosing an implant is the taking in consideration for the patient when you're choosing the implant, how long of a long-term independence clinical studies are done with implant?
It's very important. I think it's very important, but the studies, once you do the reading of those studies, you can always find something that raises questions. So at the end, I would say you go with your own practice, you see how it works, and so on. So probably we've been with the breast implants, my experience as an independent surgeon in the private practice, about 8 years, and you start to understand what works for you and what doesn't. So of course I have no idea how my results are after 30 years. I have to probably trust all those papers and scientific data and so on, or the colleagues who have those 30 years of experience. But probably it's both. You do the reading and you see how it works in your hands, because in the surgeon's experience, not everything that is on the book works well in the practice.
Got it. And also, what is the oldest implant that you have
Removed.
in your career?
I think it was about 25 years old implant, and sometimes surprisingly they look very good. So it's not like promised that after 10 years it's gonna go wrong, it's gonna go ruptured or anything. So I would say that after 10 years you can do a checkups, visit your surgeon, see how they look, and if they are fine, you can carry on. Maybe you don't need to change them.
Thank you.
They also can add about clinical papers, because I'm
Yes.
tortured a lot about speaking about them and presenting also the clinical literature, which I, by the way, very much like. I like to read the clinical papers, because I also have medical education and I finished medical academy. So I think that sometimes it is the case that clinical paper is made by really very, very advanced plastic surgeon in a very, very clean environment with a very limited choice of the products with very selected patients. And as you said, your patients are different, yes, which come. So to predict, yes, the outcome, if I come and say, oh, Polytech is only company and it's the best, and with this implant 0 complications, we're like, who will believe me? It is ridiculous. You will laugh, yes? Because it depends on the patient, it depends on the situation, it depends also on a lot of other things. So this is very also good.
We have one more question.
I just want to ask, would you agree that there is no one perfect implant? You probably have your own algorithm for every patient, and you're choosing, looking according to, as you said, the anatomy and age and etc.
It's very right. That's why or we can rephrase it that all the implants are good, but for selected patients. For you have to really find the place for them, and different technique for them. So because let's say Polytech implant, if I have Mesmo and I have patients for that, and the Motiva implant, I would use completely different techniques for those. So I don't want to be negative, so I say that all the implants are perfect, but you have to find the perfect patients for them.
And now we will move to the third presentation of Dr. Urbonas. He's a plastic surgeon at Nordclinic as well. And Tautvydas, besides being a surgeon, he is the innovator by himself. He is having two of your own startups in the medical field, about which we talked at the very first meetup we had here. And he will present he will talk about the alternatives to the breast implants and the innovations what are coming next. So Tautvydas, please.
Thank you, Agda, for my introduction. I'm really glad to be here with you today. First of all, why we get to talk about the alternatives. So Andrew introduced quite nicely that with growing knowledge about implants, with better education of the patients, we see that each artificial material, each alien body in human body has some adverse reactions, and those safety concerns, those risks always force us to seek for some alternatives. Also, technological progress enables us to do something better, and we as a curious human beings always want to try something else. On the other hand, before starting to answer the question what alternatives we have to breast implants, we have to answer the question, is this the right question to ask? Because breast implants themselves is an alternative to methods used before breast implants, so to treat the issues related with breast aesthetics. So before breast implants, surgeons tried really everything to put in woman's breast. They tried fat lumps, they tried paraffin wax, they tried oil injections, they tried even ivory balls and whatnot. So everything was tried before the invention of modern implants. On the other hand, what Agnes showed us with the very beginning, with the invention of some novelty, we sometimes forget the reason why this novelty occurred. So with the car, the first car was made to make it easier to get from point A to point B. And when the cars were evolving, the car itself became a nice thing to have. So it's like not necessarily you buy a car to get from point A to point B. And due to marketing strategies due to social media, we sometimes get lost as well, and sometimes we think about implants as nice thing to have, but we have to get back again, and it's not the same as the car. It's not we have to actually think of an implant as something that not necessarily has to get into your body in the first place, and it's very, very rare circumstances that when you cannot avoid having it. So it's more about the issue how to make distance to disappear, but not a nice thing to have in your garage. Still, we know that implants nowadays is probably the most reliable, consistent method to achieve predictable results, to achieve the stable results, and to have the 100%. If you put 400 cc implant, you know that the breast will be 400 milliliters bigger. So they are really consistent and relatively safe. So that's why today we talk about alternatives to breast implant, but not to something else. Still, there are few things to mention. What we can choose before deciding to have a breast implant. Probably most often used in reconstructive surgery is autologous breast tissue flaps. It's complex. It has quite high risks, not only in the recipient side but also donor sides. And nowadays we don't talk about it as a primary choice for aesthetic purely reasons, without having like cancer treatment or anything else. But still we have to mention this because the future might bring novelties and it can change. So soft tissue flaps is something that has been used for a while, for a long period of time, and it's a good thing to have as a tool for a plastic surgeon when you want to augment or to rejuvenate the breast. Fat grafting, also a very popular procedure nowadays. It probably boosted like 30-40 years ago, and we already have quite a lot of data collected about it, and the initial concerns about increasing the risk for breast cancer, they are in the past. Now we have really long follow-ups, and the only risk what they raise is basically the some issues when reading the mammogram for radiologists. Sometimes the fat lumps or fat necrosis can resemble the breast cancer, and sometimes a necessary procedure can be done. But otherwise they're relatively safe. The biggest disadvantage of it is of course the volume loss, and we can never tell how much of the injected volume will stay. And well, the recent meta-analysis shows that up to from 20 to 80% of the initial volume can be lost within 1 year after fat transfer.
From 20 to 80?
From 20 to 80 years. So after 1 year, that's probably the biggest disadvantage of fat transfer, that you can never tell how you end up with it. If you put an implant, you know that, as I said, you put 200, it will be 200 after 1 year, and it will be 200 after 10 years. If not, nothing serious major happens. With fat transfer, you can inject 500, but you never know whether it will end up having only 100 milliliter left, or it will be 400 something. So there's a very wide range of final results. Other alternatives are also closely related to fat grafting procedure, and adipose-derived stem cells is one of the options. Also also used for quite a long period of time. The same meta-analysis shows that it can really boost the survival rate of fat and can reduce the risk of volume loss to 20 to 60% of survival rate. So quite a bit of improvement, but again, it's pretty expensive. You need a lot of fat to produce the adipose-derived stem cells, and if you manipulate of those stem cells outside the operating theater, then regulation kicks in, and you cannot do much about it. Exosomes is a new trend in all medicine, in regenerative medicine, and nice works are being done with it, but it's still experimental. Exosomes themselves are small particles. It is not cells. They are extracellular particles that works as a messengers. They do not provide volume themselves, but they can reduce the inflammation. They can also help the cells to settle in. They can increase the neovascularization, so basically the ingrowth of new vessels in the transplant. So in combination with fat graft, probably at some point exosomes will be really widely used, but it still needs time for more data to prove these advantages. Hybrid techniques, probably the classical, most conventional hybrid technique we use nowadays is regular conventional breast implant. Doesn't matter what manufacturer or surface we use. We can add some fat on top in the tissue, so that helps us with slight asymmetries, with some maybe coverage of the implant edge. So this can be a really nice thing to have. Also, reabsorbing materials that can be used instead of implant, that can be customized, that can be printed and made for each case very specific. Again, it's very promising, but at the moment only clinical trials are made, so no such option in the daily practice, basically. External expansion device. The idea is very nice, and you don't need anything else but pressure, the negative pressure, and pressure works in our body very well. It signals for each part of the body that it needs to change its shape and grow. That happens during pregnancy. That happens when you have a piercing, and the body really has limitless ability to grow. The disadvantage of these external expansion devices is that effect can only be seen if it's used for a very long period of time, and it's really very uncomfortable. So they at some point they were kind of popular, but I think they have lots of limitations due to discomfort. So in my opinion, the future depends to regenerative medicine and personalized treatment. with least foreign material possible in your body in the long run.
So when you have a patient coming to do the consultation with you, and besides regular implants, you are also offering the different options, and what kind of these innovations you presented you are doing right now in the Nordclinic?
So as I said, most of the innovations mentioned are still under
So,
clinical trials, they experimental.
so it's fat
The
grafting and
conventional thing that we use is fat grafting. This has been in world's, let's say, practice for several decades already. But again, as I said in the first place, we don't necessarily have to look for alternatives, because in the first place we not necessarily need to discuss about the implants themselves. There's plenty of cases where a woman has enough breast tissue and you can remodulate the tissue itself without even talking about implant. I see a really common trend that first question to ask for the woman before examination is, "Doctor, can you tell me whether do I really need an implant?" And this comes, of course, from the influence of marketing and all the social media and everything. In my opinion, you shouldn't even start with this question, because in most of the cases you're good with your own tissue, so we shouldn't even start discussion about various options of the implant.
But in terms of the safety, I don't know, I'm just as a potential patient, when I'm thinking, is it safer to manipulate your own tissue because it's a milk?
No, I mean manipulate, not talking about regenerative medicine, but doing a breast lift with, let's say, what we call a mammoplasty, when we basically use the same tissue, like you are doing the flaps and reshaping the breast and basically using the same tissue just in different areas. So it's safe. It's been there since plastic surgery occurred. That's
probably we challenge different problems with that. If the girl is coming for breast augmentation and there is a girl for breast lift procedure. So with breast augmentation, the nipple necrosis, the chances of that is extremely low. Have you ever had breast augmentation and nipple necrosis? No. But if you do a breast lift, a nipple necrosis is a more common thing. So I would say that the rate of complication is still there. At the minute you do the incision, there is a chances of something going wrong. But different procedures gives you different challenges.
So when the patient is coming to you, you are discussing all the potential risks and then choosing the safest path.
Yeah, of course it depends on the patient as well. Some people come, they are very well informed. Some people, they are completely amateurs here. They have no idea what they need. They are asking, do I need implants? Do I need Botox? It's the same with the Botox. Everybody needs Botox and nobody needs Botox. So.
But it's just I'm opening the floor to all the questions and to the panel discussion and to all of you. When you were mentioning that you have to, that you are choosing the implants while looking at the specific case, at the specific patient. But in terms that we are holding the implants for the upcoming 10 to 15 years, so it really depends on the patient's actual age and lifestyle currently. And I mean, if it's a girl is young, without the kids yet, and then she will change after breastfeeding, pregnancy, and if she will gain weight, and how, as from the patient perspective, you have to kind of foresee your future in the coming 10 to 15 years while choosing the shape of the implant, material, or you have to talk with your surgeon about that?
I don't think that with the implants you can stop the sagging process of the breast, the ptosis that happens, let's say, after pregnancies, right? Because the breast will get bigger and will shrink and the skin will not contract. Doesn't matter what implant you put, it still will happen. So yes, you probably ask, you know, about the babies, whether she's planning to get pregnant again and so. And if the lady is telling that in half a year time I'm planning to get another baby, then I would say no, don't do the implants, because it's better to just finish with all your children, then come for procedure that you really need. And who knows how the breast will look after the babies. You may need augmentation, you may need just a lift procedure, so that can be a different situation after a couple of years.
Am I wrong that, for example, for the young ladies who are before the pregnancy, it's better to choose the fat grafting or the remodeling of the tissue and then to go for the implants later? I mean, how to project, how to choose the best option. If it's the patient is very young, if it's the lady after fat loss, and you need really to uplift everything up.
I would say that would be a bit of overthinking. You cannot, anyway, you cannot choose a procedure that will, again, cover everything and stop aging and will be a perfect if you decide to get married, then get pregnant, then divorce, and then get married again, and you won't get the procedure.
True.
In the end.
And based on your practice, what are the common concerns when women are coming to you? What they do express?
My biggest concern is usually understanding them, because sometimes it's pretty hard. And I'm not saying it's because they are women. I don't want to say that. I don't get confused. I just say that during the consultation you have to really listen to what the patient really wants, because sometimes they come with the idea that they need implants, but they leave with the idea that they need something else, and maybe just everything is fine, and they at the end they understand that it will be, you know, a little bit challenge for do sports or other complication risks are not acceptable, and they leave the office without any surgery but with a smile. So it's I think the consultation part is very important.
You work as a psychologist
Yes.
all the time as well.
Yes.
And Agnes, you've been talking about the innovation. We are talking about a lot about the innovation today. And you've created the B-Light implants. Did you, in terms of the timeline of the evolution of the implants itself, is the need came from the women itself, or you were the first who offered seeing the struggles they have, that they can't run, they can have a normal life?
Well, actually, in Polytech, when we look at the development of the company and changes into our portfolio, it was always plastic surgeons who came with some concerns and who offered. And in that case, it was Israeli surgeon who was searching a place where to manufacture those implants, and he, end up in Polytech factory. And when we develop any product, we are not basically only doing this to sell it for bigger money or just to now create a new trend. We are listening actually to the needs. Yes, because you said about the need of hybrid breast augmentation, yes, it can be combined. Very small implant was the fat. Why not? We have it. We are offering that. You have an older patient, like me, 2 children, no plans to do maybe the third. Why not to put me anatomical microtape? Why not? Why? I don't need a very big size of round, yes, for myself. So I think that we always listen. So also we are listening about the doctors who are asking, create now different type of B-Light because we need this and that. It's not easy because we need to comply and follow a lot of rules. Yes, it takes time, and which is good. Longer time it takes to register a new product is safer for the patients. It is not always good for company because it costs more, but for the patient, when I will approach again you after some time with something new, you can be certain that this is not born yesterday. Yes, this product is longer, long time developed.
And when we are when we are planning to have any kind of operation, we are full of hopes of how our life will change into the better, how we will look better, how we will be more self-confident. But the reality then comes back with the post-operating process. Could you elaborate a little bit more about post-op period? Is it painful? Is it worth to feel that pain, to feel better in the future? What are the risks and how to avoid them, how to prepare for them?
In the plastic surgery field, you know, especially with the implants, it's relatively easy comparing with the face surgery. We have sizers that helps a lot with the expectations and so on, and many other friends would already have this kind of procedure done. So I would say that with the breast implants, I don't see that many ladies who freaks out after the surgery. They already know what to expect. I always try to break down all the, you know, that everything will be smooth and easy. Try to say that it's going to be painful, it's going to be uncomfortable, you know, the various complications. Usually I tell them, well, I try to scare them. And if I see that they are not scared and they are ready for that, in a way that shows me that patient is ready, that patient really needs the surgery. And again, if you compare it with the facelift surgery, facelifts are definitely more challenging to deal with the patients because it's really hard to tell how your face is going to look exactly after the surgery. And at the moment, I have much more challenges dealing with them, with the facelift patients rather than breast augmentation patients.
And in terms of we touched a little bit about the beauty standards. Do you have any kind of oh my God, to explain it in English? And in the breast, this field, it's really, it's difficult to find the right words.
Benchmark.
Yeah, no, it's just when you're, when the patient comes to you and has the, how to say in English, too high expectations, or they want to have an enormous breast, or they want to have anything what is not aligned with the common sense as we do understand it. Do you tend to kind of explain them and tell them what is worth to do and what is not worth, that it's not, I don't know how even to ask. We have several celebrities in our arena right now, and as we are talking about a more natural trend right now, but still, is it came from our environment that we became, as you were saying, that plastic surgery is not already to show off, but more and more common women just want to feel better about themselves, especially after surgery, about the special surgeries, onco surgeries, after the having kids. It's more of the common practice. But if you see some kind of the situations where women want something, what would be bad for her, do you tend to atkalbėti her?
This way.
So the thing is, if you are stuck with a plastic surgery like myself, I have no idea what to do in my life otherwise than plastic surgery. I really cannot, you know, build a house or fix my car. Or it's plastic surgery is the one thing that I'll do, and probably I'm going to be doing it until, you know, the last beat of my heart, hopefully. And that
Hopefully not.
you never know. So that means that if you operate a patient who has expectations that are completely out of the window, that patient eventually will come back to you, and you will have a problem that patient will complain, and so on. So it's not a good idea to sell something to somebody that doesn't really need it. So that is what I'm trying to do in my practice.
To make it simple, let's say that plastic surgery is as any other field of medicine. You try to solve the issue, not to create one. So if the patient comes to you and she doesn't have an issue, but she asks for one, your answer is very simple.
No.
You don't have to create an issue. Our goal, we serve here to help patients, not to destroy their lives. So even knowing that sometimes we fail, and when the patient comes and you already see that she wants you to destroy her life, your choices are very simple. There was, by the way, like, I don't know, 20 years ago or even earlier, like a competition between plastic surgeons where who will put bigger implants. And we all know how these competitions ends up usually in intensive care units.
But do you have to consult and be in contact with your surgeon because you're operating? I mean, the people and they're traveling through one country to another. Is it recommended to have one surgeon and to consult year after year? Do you have the regular checkups after, I don't know, 2, 5 years, 10 years?
If we're talking about the breast implants, usually I say that you need, if everything is fine, basically every morning the lady should stand in front of the mirror and see what's happening with their breast. And for the first 10 years, if everything is fine, if she doesn't have any complaints, she don't need to do any checkups, all right? After 10 years, even if everything is fine, those checkups are needed. And I don't think there is a huge difference whether that checkup is done by a specialist who did the augmentation or by the other specialist. As long as it's done, they do the ultrasound, they can do the MRI scan, make sure that everything is fine, no fluid accumulating, the implants are intact, they can carry on. So that is the common thing that I say to all my patients about the breast augmentation. If you're doing other surgeries where there is no foreign body inserted, okay, you do just a lift procedure, right? So after a year, you make sure that everything is fine, she gets a final result, and she doesn't need to come back for a checkups. So that's the general idea, general rule.
I'm talking about the future, and the future you talked about this crazy future, the exosomes and all the other amazing stuff. How do you project when it becomes the reality? Because everything is under the clinical trials. So 15, 20 years from now?
Well, so future never comes, it's always in the future. I mean, nowadays exosomes looks like a bright future.
3D printed scaffolds, this is really also...
But you have to think out of the box. Maybe none of this will be something that will change the I saw the animation of in the Agnes presentation, how the implant changes its shape during physical activity.
Not the shape, implant, but the breast
The
itself,
breast,
how
yeah,
it's
itself.
made.
So
Yes.
I was just thinking of the, let's say, intelligent implant that could grow in size, shrink when you, for example, running the implant shrinks when you are in the party for a date.
If your husband doesn't behave well, I'm minimizing my
disappears.
breast size 2 times. He's not doing any fun.
Actually, we have this. Even in our bodies, we have parts that can shrink and grow in different circumstances. That
I can add about our Implants of Excellence program, because we are also asked, because sometimes patients come here and they do the breast surgery and then they travel somewhere back, maybe yes, they live elsewhere in foreign country, Of course, if they are registered into the program, the implant warranty will work also in the other country, yes? So she can go. The thing is to be registered, and this is a little bit challenging because sometimes ladies don't think that the breast implant is like purchasing the new car. When you buy the car, you need to buy insurance. In this case of Polytech, you don't need to buy anything extra, you just need to register the implant serial numbers, yes? And you do it so you are protected wherever you go. You can go to Australia, you can go to
Ivory Coast if you want,
Yeah.
you know, anywhere.
not outside the Mother Earth. It's I don't know what's written about that, but
And do we have any questions? Yes?
Well, talking about innovation in implants, so you probably heard or saw that one of the companies are introducing the implants that are inserted through the armpit for very, let's say, skinny patients and those with local anesthesia. So what is your opinion about this, and do you think there's a need for this product in the market, or maybe it's a push from the industry?
I would dedicate this question to doctor.
You are talking about the implants that can be filled after insertion, because each implant can be inserted through the armpit incision. It's not. It's more like a choice of.
Yeah, I understand. There's different techniques, but no, one company creates dedicated product for very, let's say, skinny patient with small breast, and it's limited in the volume, but it's inserted through the armpit and with local anesthesia. So you haven't.
Well, so I've seen the ideas about breast implants that can be filled after insertion. They can be inserted through belly button, through armpit, through wherever you can do. What your imaginations brings you, you can put the incision under your feet and then insert the implant. It's not a big issue, but why to do that? The question is, I don't see a big.
It sounds a little bit like a marketing idea.
It's marketing idea,
to
like-
present something that's been here already. So any implant can be put through the incision in your axilla, and then
There's
does
no-
here he's a specialist for that. Probably in this
no,
clinic
no
he can
issue to
do
put
that.
B-light, no issue to put any other implant through armpit for axillary incision. Every implant can be placed, especially if it's small. So then it's even easier. But it's
Probably the idea was to make sure that the incision is as small as 1 centimeter.
Yeah, and then you can like almost inject the
Yes,
implant.
but you really have to consider whether it's really safe, because once you do a big incision, you control the pocket. You can stop the bleeding, because the bleeding is again associated with capsular contraction and so on. If you do a blunt dissection or technique that they're using, they are putting sort of inserts like expander to expand the area and then inject that implant. That cannot be controlled that well. So I think that all the techniques, they have advantages and disadvantages, and sometimes they have more advantages in social media way of presenting it rather than the technique itself. So.